morning, all. I hate to break up the conversation because in some ways that's what it's all about, is us getting together, helping each other in so many different ways on so many different levels. But having said that, I know there's some information we need to get across today. So just a reminder, ALD Connect is all about being a resource on many levels, to physicians, to scientists, to industry, to newborn screening stakeholders, and utmost to patients, families, and all of that. So today's our Patient Learning Academy Day, which means it's all about patients, families, learning. And I will also say it's about physicians and scientists and industry learning as well. And I mean that in many ways. One, yes, there's the science of it and the medicine and all of that, but it's also learning from patients what's important to them, what it's like living with the disease, what it's like taking care of family members with the disease. And unless people are vocal and engaged, we're not going to make the most of our time together. So my big ask of everyone here is for this to really be worth everyone's time to the utmost, is for everyone here to feel like you need to engage in this conversation. So if you look at your agenda, the first person who's going to speak is Florian Eichler about the biology of ALD. And just to remind, that is my favorite song, so that's okay. So when Dr. Eichler talks about ALD, everyone here is in a different place in their journey of learning. So you may feel like, I'm just new to this. I can't ask that basic question. Nobody really wants to hear that. That's dumb. Erase that question from your mind, because everybody's been there. They didn't understand, oh, there's two different phenotypes, what cell types, all of that. There is no basic too early question to be asked here. And I will tell you, having been dealing with ALD for 18 years, things that I thought I understood, as I hear other people explain it differently, I realize I didn't completely understand it, and now I understand it on a different level. So we're always learning as other people are asking questions. So now, I'm wondering if that's why, oh no, you are. I thought Florian hit the road because I told him that I was going to ask you guys what you want him to say and talk about, and what questions you want him to address. So Florian, if you don't stop him, will go on and on about ALD and pathophysiology and cell types. So your challenge is to stop him and ask him the questions that are meaningful to you. Okay? So that's your assignment for this one. And then as we go throughout the day, if you will kind of allow me to interject when it comes to the questions and answers, just to really push you guys to ask more, because that's the only way we'll get something really meaningful out of the day, if everyone here is super comfortable engaging. And look, it's a Saturday, we're relaxed. From what I understand, some people had some nice pub crawls last night. I don't know how, because it was raining, but I guess I'm the only one that melts in the rain. But so it should be a relaxed day to learn and engage at that level. So while Florian's getting his slides together, can I ask someone to say what's one thing they would feel really good about learning by the time he finishes talking? Like what you would feel good if you knew X. Oh, come on, somebody's got a question. Yeah.
The difference between stem cell transplants and gene therapy, and what the outlook is for both of them.
Okay, Florian, so you'll address that, the difference between stem cells and gene therapy treatment for ALD? Any other things that people want to make sure they get out of him today? Here, we'll do other mics.
This table wants to get out of him if there is any evidence of changes in perfusion. This collective table would like to get out of him if there is any evidence on MRI that men with AMN have perfusion changes that cause personality changes.
Florian, I'm not writing these down, so all right, he's remembering. Okay, here's another one. Oh, there you go. Wait, that mic needs to be on?
Just hold it, it's a quick one. I would like to hear more about the role fatigue plays across all phenotypes and genders.
All right, so that was a question about what role fatigue plays in the different phenotypes of ALD.
Sorry, say that again.
The role fatigue plays. Are there other things, or do you want to get started? And as you speak, all right, Florian will get started, but start jotting down other questions you want him to address, because we're not letting him go unless he answers all your questions.